Welcome back to Awaken with Me, helping you become aware and empowered on all things health and wellness on your health and healing journey. Hello, and welcome back to Awaken with Me. Today, our guest is Dr. Allen, who is a neuropathic physician and licensed acupuncturist at Essential Natural Health in the Richmond, Virginia area. Dr. Allen's patients span the entirety of the age and disease process spectrum from pediatric to geriatric and general wellness to complex chronic disease. As an expert in her field, her patients benefit greatly from her extensive knowledge of natural care options available for her patients that include but are not limited to lifestyle modifications, herbal medicine, nutrient repletion, acupuncture, and Chinese herbal medicine. Dr. Allen received her doctorate in neuropathic medicine and Master's of Science in Acupuncture and Oriental Medicine from Bastyr University in Kenmore, Washington. Thank you for joining us, Dr. Allen, and I look forward to the wonderful information that you'll share with our listeners today.
Awesome. Yes. Thank you so much for having me and sharing your platform. I'm really excited to be able to share and shed some insight and light into how I navigate through the health and wellness space and with sharing that hopes to be able to help inspire and motivate your audience.
Awesome. So let's start by hearing a little bit more about yourself and how you got started in natural medicine.
Yeah. So I have a bachelor's degree in animal science, pre-veterinary medicine from Florida A&M University. And I know your audience will probably hear that and say, "What? Like, how did that transition into naturopathic medicine, especially working with people?" But during my time at Florida A&M, we had rotations with animals, farm animals, and that portion of my experience wasn't necessarily what I was there for. So more working with small animals, cats and dogs, had been what I had grown up doing.
Okay.
And so during that time on the farm, I said, well, is it possible for me to have a different research project? We had a pharmacy school, so my instructor at the time allowed me to do some research there where um, I looked into Parkinson's disease and just the root and the origin of it. And then another project that I did was being able to shadow a gastroenterologist who was also a pharmacist. And I did rotations with him over a 3-month time frame. And during that time, we had an opportunity to do patient care. Are you still there?
Yeah,
Oh, I'm sorry. My computer is
no
really,
worries.
really funny there. Sorry. Yeah, so we were able to do patient care. He also had a surgical suite, so I saw a host of endoscopies and colonoscopies. But when we were in patient care, I mean, say we had 15 to 20 people that we saw for reflux disease every day. Each of those patients, I'm sure their stories were all different. Their reasoning and origins for their presentations were all different, but they all got acid blockers, right? So the other part was that um, their intakes and their visits were between 5 to 10 minutes. The typical visit time is 7 minutes, but 5 to 10 minutes was how long their visits were to check in with their GI doc. And so the ability to be able to get that extensive backstory to understand why they may have been where they were, whether it be, secondary to stress or secondary to food choices, we didn't really get an opportunity to understand or for them to shed light on that information.
Yeah.
So therefore, that blanket treatment of an acid blocker was, what was in the toolbox for that GI doc, and basically what everybody got. So for me, I thought to myself, because during our lunches we would talk a little bit more extensively about diet and exercise and how those things impact health. But we didn't get an opportunity to impart that information and knowledge to the patients. So I thought, well, man, it would be really cool to be in a profession as a naturopathic physician, which I didn't know anything about at that time, to be able to be congruent with what I would do for myself and my family and what I would do and provide for my clients and patients. So I found naturopathic medicine, and it resonated well with that core value of mine, and that's how I started my journey in naturopathic medicine and wellness and healing. So that's the short story.
Yeah, no, thank you so much for that and for being thoughtful about the process, because having been on the other end of, a patient going to the doctor, I've definitely seen where a few minutes is not enough time for them to actually get a better sense of more about you, to explore what you're actually going through.
Right, you're absolutely right.
Can you tell, you mentioned the acid blockers. Can you tell us a little bit more about that, and maybe how that relates to the reflux and gut health? Because I have seen a lot of people struggling with gut health, especially lately. And I just think that's like, because from what I know, because I had SIBO, or maybe still have it, and I'm addressing it still. Um, that gut health can have a major impact on a person's overall health and wellness. So, can you talk a little bit more about that?
Yeah. So the specifics around just acid production and like a prevalence of it can be rooted in a number of things. It can be due to again, diet or food choices. It can be due to increased stress. And so I see a lot of folks who have, gastric ulcers secondary to increased acid production. But where we get into a difficult time is when we introduce acid blockers into the system, and we basically decrease or completely eliminate the production of acid. And so when that happens, there are a number of things that can result. So we need the increased acid in the stomach because it helps to break down the food into smaller proteins or smaller carbohydrates so that they're digestible in the small intestine. And so if we don't have that acid available, then what can happen is those larger proteins and larger carbohydrates aren't adequately broken down. And so we have an issue where we have malabsorption. And that, subsequently can lead to nutrient deficiencies. We're also very aware that we need acid in order to start the process of B12, an intrinsic factor, to bind and again, therefore, be absorbed in the small intestine. And so, without acid being present, that process does not take place, and therefore we can see a deficiency in B12, which can lead to a number of different presentations, some being neuropathy, some being cognitive decline, others being severe fatigue because there isn't any energy metabolism. Um, there is a specific B12 deficiency related anemia. And so yeah, with the acid blockers, um, if it's something acute, because obviously we don't want to have any excessive acid production where we're moving into erosion or damage of the esophagus, right? But there are absolutely um, other options that are available, hence looking for the root, figuring it out, approaching it in that way. rather than chronic use of acid blockers.
Okay, so just to clarify, acid blockers would be something that a doctor would prescribe for someone facing gut health issues. But there are alternative methods.
Yeah, so when we think about acid blockers, and so they're some of the most prescribed medications, at least in the top 10 medications. So the acid blockers that you all would probably be familiar with are your Nexiums, your Pepcid ACs, Prilosec, Protonix. All of those guys are going to be acid blockers. And again, I'm not saying don't take your medications that you've been prescribed. What I am saying though is investigating a little bit further, whether once you get to baseline, looking at some of the other causative factors that might be producing those symptoms, and working from there.
What are some of the symptoms that people first notice, like when they come to you for treatment?
Yeah, so my naturopathic practice now is solely focused on hypertension and hypertension resolution. And so most of my patients now who I see within the legacy program will have experienced symptoms related to high blood pressure. And so those symptoms can include headaches, fatigue, changes in cognitive ability or cognitive decline, issues with shortness of breath, issues with, again, energy metabolism, headaches that are unexplainable, um, chest pains sometimes, not most of the time, but those are most of the symptoms that we see with folks who are in the legacy program.
Those, like, some of those were some of the same symptoms that I was experiencing when I was going through my episode of just crazy symptoms that I didn't know was happening to me. And it just reminds me of how wide a spectrum your health can be, because it can be related to so many different things. Like one symptom or a set of symptoms can relate to so many different things.
Right, right. And so I would say like an umbrella symptom. And I like to think about symptoms or ways when our body feels different or we don't feel like we're quote unquote on our A game, is that our body is trying to tell us that something is awry, right? So fatigue, that can be a symptom of, just like you said, so many different root causes. It can be stemming from the gut. It can be stemming from the vascular system, where you aren't getting an appropriate amount of oxygen to the system. It can be from, malnourishment. Um, it can be from extreme stress, right? Because the body is just overworked. So you're absolutely right. And that's why it's so important for us to have a healthcare team member who's going to investigate, whether that be through testing or physical exam, and really figure out exactly why and where those symptoms are coming from. And the other, biggest biggest help for us too is listening to the patient, because I tell patients all the time, they'll say, well, obviously I'm coming to you because you're an expert in your field. And I always relay back to them, I'm an expert in my field. I'm an expert in naturopathic medicine and Chinese herbal medicine. But ultimately, you are the expert of your body. So it's a partnership. You tell me where you are finding and noticing where your body is not responding how it was before. And based off of your explanation to me of how your body is not performing as you would like, I then, as an expert in my field and in the human body in general, will then apply my knowledge to where you feel you need more support.
Can you tell us a little bit more about the diet and how that relates to the overall health of someone?
Yes, diet is the number one predictor, because that's where, again, we are getting all of our nutrients, right? That's where we're getting all of the building blocks that we need in order for us to perform at our best and have optimal health. So
Mhm.
if we are getting diet wrong, there's going to be a difficult time for us to have that healthy outcome that we're looking for or looking to achieve. So again, I know that we're all aware of what's called the SAD diet, right? Which is the standard American diet. So standard
Mhm.
American diet that's going to be high in um, saturated fats, high in salts, low in fiber, low in complex carbohydrates. Um, that approach, that way of um, engaging with food in the long run is not going to result um, in healthy outcomes. But what it will result in is a series of chronic disease. And so, diet and movement of the body is absolutely key in my practice, mainly because I see it as a naturopathic physician as it's ground zero for our health. So, yeah, very important.
Developing better habits and self care routines has been such an important part of my healing journey. Check out my website, awakentoyourpassion.com, for access to some of the resources I've found useful that might also be helpful for you. Stress always comes up as like one of the big things. Like I remember like when I was doing research for like just any symptom that I would experience, stress would always come up. So what are some suggestions you might have for how people can manage their stress?
Yes. And so, um, stress, I know over the last 2.5 years, and we're still within and coming out of the pandemic. I have seen, like I've already, prior to the pandemic, stress, just everyday stress was really difficult for folks to maneuver. But with the pandemic, it exacerbated that stress. Um, so I would say the top three things that I would recommend for helping to manage day to day stress, because obviously we cannot eliminate external stressors.
Mhm.
The only thing that we can do is learn how to navigate them and how to manage the stress. So,
Mhm.
number one would be exercise and movement. Um, my recommendation is a minimum of 30 minutes of movement 5 days a week. So 150 minutes total of movement over a week's time frame.
Mhm.
So some of my patients will say 30 minutes a day, 5 days. I say, okay, well, 150 minutes. And you chop it up however you want to over a 7 day time frame. If you want to do 10 minutes 3 times a day,
Mhm.
go for it. If you want to do 15 minutes in the morning, 15 in the evening, you do it that way. But I mean, you see, like just over time, if you look at it, it's really not much to meet that minimum, right?
Mhm.
So that would be the first goal. And so that movement, you can ride a bike, you can walk in your neighborhood. Um, I also include cleaning. If you're at home, you're vacuuming, you're mopping. All of that is included in movement for me. Okay. So movement is one. And then the second is like a meditative form of movement. So whether it be a seated meditation, yoga, a little bit more movement, Tai Chi or Qigong. So all of those are going to be moving more inward, steadying that inner voice, and increasing the presence of the parasympathetic nervous system, which is more resting and digesting. Okay, so it's moving us out of that fight or flight mode and into being more grounded and centered. Okay. And then the last one is going to be sleep. Sleep is so vital. I think we've, as a society, we have grown accustomed to working ourselves to the bone, burning the candles at both ends, and not being intentional about sleep. Several studies have shown lack of sleep, or even if we look at shift workers, folks who work overnight, those folks see an increased likelihood of chronic disease and more specifically cardiovascular disease or heart disease. Okay. And we know that heart disease is in the top 3 causes of death. So sleep, get your sleep. Um, Typically 7 hours of sleep is going to be helpful. I know there are some folks who say that they can manage well with 5 hours, 5 to 7 hours, but trying your best to get continual sleep during the evening hours is going to be beneficial for reducing and maintaining stress. Again, mainly because we're going to be steadying the adrenal glands and decreasing any additional production of cortisol, which puts us into that fight or flight mode. So I'd say active movement, restorative, centering movement, and sleep.
Awesome. Sounds like a good balance. In doing some reading, I realized that women are affected more by many conditions, including autoimmune conditions. So I'm wondering about the patients that you see in your practice. Um, do symptoms differ between men and women, or do you see one group more as opposed to another? Just curious.
Yeah, I would say historically, when we talk about autoimmune disease, there is a higher prevalence among women, mainly because there is a hormonal component. A lot of times with autoimmune disorders and diseases, but say if a man or a woman were to come in with lupus, I don't necessarily see that the woman's symptoms are more progressively, worse or advanced just because she's a woman. So, and then in my practice, I do see I would say a pretty even number of men and women in my office. So, yeah.
Okay, I was just curious about that. So thanks for sharing.
Yeah, no problem.
So now that we're coming to a close, is there something, one final thing you would want to share with our listeners?
Yeah, I would just say, as it relates to your health and, um, going on a more healthy or holistic journey, just listening to your body, listening to how your body is responding to your environment, what you consume, right? And that can be socially, that can be how you engage with food, that can be on the mental, emotional plane, but just being very intentional about tapping into and listening to your body and letting it guide you to where you need to be, and also making sure and knowing that as it relates to your healthcare team, having someone who will advocate for you and someone who will then take that information that you've received from your body and use it appropriately in order to help elevate your health and therefore elevate yourself to a more optimal health. So that's what I leave you guys with. My last thought is just listening and being intentional to and with your body.
And that is quite awesome. um, can you tell us where to find you?
Yeah, absolutely. So I am Dr. Micah Allen on, I don't tweet a ton, but on Twitter, Facebook, and Instagram is Dr. Micah Allen ND. And so you can find me on all platforms that way. And my website is drmicahAllen.com. And yeah, go ahead and check out the website. And like I mentioned earlier, if you or someone you know is looking to find the root cause of essential hypertension and resolve your high blood pressure for good, check out the Legacy program and schedule a clarity call so that we can see if it's a great fit for you.
Awesome. Thank you so much for being a guest on Awaken with Me. It was so great having you.
You're so welcome, and thanks again for sharing your space and your platform.
So today's learning outcome is to listen to your body, be it mentally, physically, or emotionally. And also be sure that the people who are a part of your care team are people who will advocate for you and your best health. Thanks for joining us on today's podcast. If you haven't yet done so, hit the subscribe button for new content every 2 weeks. And be sure to visit my website, awakentoyourpassion.com, for more resources. Until next time, take care.